Hello, welcome. Again, my name is Dr. Kyle Richmond, owner of Rebuilt Strength and Rehab, sports chiropractor here in New Lenox, Illinois. I've been in practice for 4 years almost, 2 on my own. On my second location, I say second location, it's a new location, still only one clinic, but always looking to grow and expand. I treat everyone from your normal everyday people, office workers, gym goers, to pro athletes, to high school athletes, basically a little bit everybody. There's always a common misconception that chiropractors only treat like people with back pain, which feels like my back and shoulder pain or back and neck pain cases have been much lower lately. With weather being nicer outside, I see a lot more hip, knee, ankle, foot, plantar fascia all the time, shoulder, wrist, you name it. I'm able to treat anything musculoskeletal, knowing my limitations. Today, I want to talk a little more towards the focus of fascia and kind of what it is, and more so pertain to the plantar fascia, which we talk about a lot. But fascia is a connective tissue, so we have to differentiate connective tissue from muscle tissue. Muscle tissue is that red tissue, is contractile, so it's going to contract and relax like when we're lifting and moving around. Our fascia is white connective tissue. That has a different loading strategy. Usually responds to long times under tension, manual inputs, so like massage, stuff of that nature. It's dictated by our nervous system in terms of how much tension it can have, and we'll talk later mechanical versus neurological tension. But fascia is different than just muscle. So we're almost better stretching fascia than we are just trying to strengthen fascia in a sense. The literature is kind of all over the place, depends on what you look at and what you think, but if you understand the difference, there's muscle and there's fascia, that can help us at least differentiate what we need to do for our pain. So when we're talking about the plantar fascia, that's what runs under the bottom of our foot. So if we were looking at our foot like this, there's a big piece of white tissue here that kind of holds the arch of our foot. So a lot of people get plantar fascia, will say they have pain somewhere beneath here. Could be the heel, could be all the way up to the toes. So what I want to do today is we got a lot of really good questions. I'd rather run through a lot of these, and then if anybody has additional questions, go ahead and drop them in the chat here. I feel like that's been the most benefit to a lot of these lives that we do, and you get to watch back and kind of listen to these anyways. So let me work through the list, and if anybody is here and has questions, just jump on in. I'll try to answer them when I see them. So first one, my arches feel tight after long walks. Could be from fascia. So yes, it can be from fascia. It also can be from weak muscle and tissues in our calves. So that tightness usually means something's like overworked. So I don't know if you've gone to the gym and you do a bench workout or shoulders and you feel this like tightness afterwards because they feel inflamed. It's because you worked them a lot. So depending on how far you're walking, you could be doing a lot, and you're working the muscles and the tissue, which is not a bad thing, but it all depends on how long it hangs out for. Let's say we walk a mile every day and that tissue is always aggravated. Well, maybe it's not strong enough to handle a mile. So maybe we need to add some strength work in from the calves, the feet, the Achilles, hips, hamstrings, you name it. So then your capacity is to do 2 miles, so doing 1 mile is like nothing. So yes, it can be fascia. Yes, it also can be muscle. It's kind of hard to differentiate. So I always tell people do both, do the soft tissue work and do the strengthening exercises. I think most people just sit and do one. So like people take their Vibit and they'll just roll out. It temporarily relieves our issues, but we also need to do some strengthening work to help reset how much tolerance we have in that tissue. Okay, so I hope that one answers that question. That tightness, we could also talk about 2 kinds of tightness. There's tension, mechanical tension, and then there's neurological tension. Mechanical is like tissue damage. You have scar tissue, you have fibers that don't really glide well mechanically. That responds really well to like manual therapy. Neurological tension, or I'm sorry, mechanical also responds well to loading. So like me getting in there and getting stronger and doing some manual work as well. Neurological tension is your brain putting like a brake on the system. It's taking the muscles and tensioning them, even though there's nothing wrong with them, but it's trying to protect something. We also can deal with that through manual work or strengthening. So you have to kind of know what kind of tension you have, and that can be well defined by a good clinician. Next question, I just got my roll. What's your favorite way to use it? Okay, so a lot of people will take their roll and they'll just start going really quick on it. You need to slowly put pressure on and let the roller do the work for you. Slow time under tension, so you saw from here. into that. And then find a spot. You can also go side to side on it too. So you have all these little ridges on here. Let these do the work. Change the angle of your foot. So instead of just rolling forward and backwards here, we can also go that side to side. So you can go from here and slowly work your way across one way, slowly work your way across the other way. That's for the feet, and that also applies to anything else. Like if I'm rolling out like my tricep, I would take it, let's see if you see this here, and I would slowly work my way. I find a really sticky point or like a really tender spot, and I can move now side to side and strum those fibers that way. Our fibers of our muscles all run a certain direction. So we can do manual work going up and down. We can also go across, like cross-frictional, if you've ever heard that. That can help break up the adhesions a little better than just going along the muscle belly. So you have two ways you can go about that. But when you're using your roll, I suggest slower motions, so side to side, and then just spending time. You can also just sit there and let the vibration do the work for you. Too many people are just literally getting on there and going like back and forth, back and forth, back and forth. You're not getting a lot. Time is also on your side. Spend a few minutes. Don't just go for 20 seconds. Kind of felt good, but like give it time to get blood flow in there, circulation, really let the nervous system calm down. Hope that answers that one. What actually causes plantar fascia pain? I don't get it. Okay, so pain is, if you have the ability to watch my last live from last week, pain is super multifaceted. There's so many different kinds of pain that, you know, it could be irritation of the tissue that we did too much. There could be other stressors in your life, like your nervous system is on override. I don't know if anyone's experienced this with like anxiety. You know, you're already anxious, and the littlest thing sets you off. That could be the same with the tissues in your foot or in general in your body. You've had enough stressors that over time that last little one puts you over. Think about waking up with pain. You know, you were sleeping the whole time. Why do your feet hurt in the morning? You weren't working them, you weren't doing anything. It could just be that the tissues are irritated or that your nervous system is just going crazy dysregulated. So it's kind of hard to answer like why does plantar fascia pain happen. You have to get someone that can help you diagnose that in terms of, is it actually mechanical? Are your tissues super sensitive and inflamed? You know, look at your lifestyle. Are you walking a ton, running a ton, moving a ton? Or are you really sedentary and your tissues are really hurting? Well, that's different. That could be a stiffness and like neurological tension. Your body's guarding something. It's weak. So it's always hard to answer that question. Just, you know, it's never black and white. A lot of these things that I talk about in terms of pain is, you know, there's a gray area. And a lot of patients come in, I always say, hey, it depends. And then X, Y, and Z. So you have to understand what your situation is and where you're at. Okay, I've tried stretching my calves, but they're always tight. What else can help? Okay, let's go back to the two types of tension, neurological and mechanical. Are your calves tight because you had a surgery? Like people who have Achilles ruptures and surgeries like that, they're gonna feel tightness because the tissues change mechanically. They could be tight because you have a neurological tension, weakness, or guarding. Are you guarding because you don't use those tissues much and then you did a lot of workout and you get this spasm, or are your tissues weak? Most people don't train their calves. Calf raises and like soleus work is almost unheard of for most people, but we need that strength because we're using our calves all day long. So it might be the thing you kind of put towards the end of your workout, like I do calves every once in a while. I would put that higher in your workout. Also differentiate between soleus and gastroc. So you have two muscles in your calf, a flat one that goes on the back of your leg, and then you have your gastroc, which is like the round one that everyone sees. Soleus, the flat one, acts on the knee when it's bent. So doing like bent knee calf raises and straight leg calf raises, two totally different exercises and two totally different outcomes on that. So if you're feeling this constant like tightness there, I would suggest spending more time strengthening and not just stretching. You can do the soft tissue release before, use the Vibit and roll in there and dig in there to help, and then go and strengthen right after. Let's keep knocking through these. I stand all day for work and my feet feel wrecked. Any tools that actually help? The obvious one's this. Use the Vibit to help reduce tension. You know, you can stand at your desk and roll out your feet. That's step one, reduce the tension. Step two is, hey, focus on getting stronger. A lot of people forget about like foot exercises, like squeezes and like toe cars, like raising the toes individually, or like big toe, little toe. I know I'm showing you on my hands, but think of these are my little toes. This is my big toe. Being able to actually control the muscles in our feet. 25% of our ligaments, tendons, muscles, bones are below the ankle, or like shin down, you want to call it, ankle down. A lot of stuff we could work in there, but most people don't train it. Most people can't like pronate their foot, which means like flatten their arch. Most people can't even pick up and supinate their arch. All those things really, really matter. And when you're standing all day, you might feel like, oh, I'm getting them stronger, but you're just standing in one position. So a recap on that, if we're standing all day, I would roll out your feet, help feel better, and then strengthen them. That's why we're feeling like they're absolutely wrecked. Your tolerance is only here. I gotta build your tolerance up. We hear tolerance for a lot of things, like tolerance to alcohol. It's a real thing. Your body's only used to a certain amount. When it comes to tissue tension or strength, if our strength level's down here, but I'm always up here, I need to raise that level so when I'm doing stuff here, it's not at the peak. I hope that one helps. That analogy seems to work for a lot of people. Is there a difference between muscle tension and that deep, stiff feeling? Kind of goes back to that mechanical versus neurological tension. Neurological is going to feel like the whole muscle's tight. Everything's tight and stiff. And mechanical tension can just be like certain little parts are kind of like tight. But achy can also be more of a joint thing too. So let me read this again, make sure I'm not missing this. Is there a difference between muscle tension and that deep, stiff feeling? They're kind of one the same. Like tension's gonna feel stiff. It's just what kind of tension do we have? Is it mechanical, where I can solve that easier, or is it neurological, where like my body's guarding something? A lot of people may have like cramping or Charlie horses that it's from like them protecting an overstretched muscle. We get small spasms in muscles a lot of time that causes that tightness. We got two more here. My heels burn a little in the morning. Is it normal, or should I be doing something? Heels burning in the morning can a lot of times be a spine issue. So our low backs can refer pain down all the way to our feet and ankles. A lot of people wake up with like that rock in their shoe feeling, or like pain under the heel, especially if it's unilateral. One side, I would look at the back. Have somebody rule out. McKenzie, MDT practitioner would really know that well. I always roll at the spine first here in my clinic before we get into the feet. You can't have a split where it's like 80% spine referral, 20% pain in your feet, because the pain in your feet are finally getting pissed off because they haven't been worked properly. But I would be doing something about that, especially burning sounds more neurological, which means nervous system, which can be the spine. Or it can be trapped anyway up into that hole from foot, calf, hamstring, hip. You can get a little bit of like a nerve adhesion, like nerve flossing is really big for that. But that's a really good one to get diagnosed from a clinician. That way you're not spinning your wheels. A lot of people just keep doing soft tissue work over and over and over and over and over, but it comes from the back. So if you're super sedentary in terms of like work, if you're at a desk, driving, flying, I would get your spine looked at. And then, do shoes really make that big of a difference for foot pain? Yeah, I would say so. So depends on what shoes you're wearing. If you're wearing a shoe that has a high heel in it, you're spending a lot of time in that like shortened Achilles. So let's exaggerate here. Shoes have this thing called a millimeter drop from toe to heel. The less of a drop, the higher the drop, the more inclined you are. Like think of heels, okay? So the Achilles back here is starting to shorten. If I have a called lower millimeter drop, which means how high it is from my heel to my toe, that puts less stress in the Achilles, which will put less stress on the plantar fascia. Now the caveat to that, a lot of people will go from those normal high, like, I'll show you, like my Adidas, right? I have a little bit of a heel on these. I don't wear them all day long. I treat them for a few hours, and then I usually go to other shoes. But if you've been wearing traditional gym shoes or tennis shoes and you go to the barefoot shoes, you're gonna experience some foot pain if you go from 0 hours of barefoot shoes to 8 hours of barefoot shoes, just like anything else. Like if you go from no walking to a ton of walking, it can cause pain. So your shoe does matter. I tell people try to find something that is comfortable, but also like has a little bit of a wider toe box, can feel good. Like I naturally have a wider shoe, so like Nikes and stuff of that tend to scrunch my toes up more versus, I'll show you a difference. So here's my Nikes, kind of narrow, right? See that? Here's the toe box on my Vivos. Significantly different. Wider toe box, more narrow toe box. I train these sometimes, and I train these more often than not. So it's all about moderation. I would switch it up. You know, if you wore heels all day, it wouldn't feel good. If you went barefoot all day, probably doesn't feel great. People like think barefoot is like the best thing ever, but if you're walking a lot, it's not always the best. Let's look at questions. Okay, I think I answered most of those. There's a little more of a broad topic today, talking about fascia, and it's a lot of kind of it depends answers, which I'm sorry for those. Maybe it didn't fully clear everything up, but maybe I gave you some stuff to think about. I encourage you all to digest that information. Come back next week with more questions regarding these topics, or if you're like, hey, you kind of answered this, but not fully that, throw it back in here. And then if you're around, feel free to join in on these lives in the chat. We're going to maybe find a different day here soon, but if you're around, we can have some dialogue back and forth and really try to tease out some of these questions for you. So, like I said, my name is Dr. Kyle Richmond. I appreciate you guys being here and giving me these questions to answer. So if you have any more, throw them in the chat or answer the email we send out. And if not, I will talk to you guys next week.